Hey, arthritis warriors, this is Dr. Joff, and I'm here to tell you a story. My friend called yesterday and he said, Joff, my mother fell and she has a fracture in the neck of the femur. What do we do? And of course, I told him that his mother, who could not stand up, really needs surgery. She really needs to get back up and walking again, which is very, very possible. Now, what is a fracture in the neck of the femur? So, is this is the thigh bone, this is the femur, and this is the femur here. The neck of the femur is just there. So in elderly patients, a simple fall can cause a fracture. This lady fell down and broke her hip. So if you fell, I mean, maybe you're 20, 30 years old, you would not break your hip. Your femur bone, and this is an example of that femur bone, would be very strong. And in elderly patients, most of them, they have brittle bones. That's again called osteoporosis. When you look inside their bone, it's going to be very different. So if you see this is brittle bone. The stronger the bone, the more dense the compact is what you see in younger patients. Because your bone is brittle, because of osteoporosis, this can cause fractures. Sa Binisaya pa, kani ligon pa ni imong bukog bay, ligon pa ni imong bukog diri ma'am, pero ang kaning usa kay gabok na. Dali ra gupok, dali ra mabali ang bukog. Symptoms like groin pain or sakit sa bugan, they have a shortened limb, sometimes nakatuyok or externally rotated, and lastly, they are in so much pain that they can't move properly. And this is what I always tell my patients who have hip fractures. Hip fractures need urgent surgery. If you don't, you leave them as is. They lose muscle, the bone becomes even more brittle, and what happens? The cartilage gets destroyed, the bone dies. It's a process called AVN, and this will also cause post-traumatic arthritis inside your hip joint. So my friend was asking me, Doc, kaya pa ba ni Mama ang surgery? She's 60 years old, she's 70 years old, she's 80 years old, she's 90 years old. So I've done patients around 60 to 90 years old with hip fractures. I've done surgery on them. And the truth is, we need to make sure that they are safe, of course. We need to check their hearts and lungs, and that's why I refer them to a internist to make sure that the procedure is safe. And I'm going to share with you that yes, kaya pa if the internist says so. And most of my patients are walking and they are very happy, both young, like 60 is relatively young, or the older, mga 90-year-old, 80-year-old patients. So the patient may be 90 years old, but they're very, very strong and they look very, very young. So that is possible. Physical therapy and rehab is very important, which is why I always recommend it for all my patients. In general, if you have problems with money, problems with how expensive the surgery or the implants can be, I can help you. And this is going to be in the links below that I've helped my patients get some from the SWD. PCSO is also very helpful. If you're a resident of Cebu City, CHAMP can be very helpful as well. So we also do charity surgeries in the hospital. So if you are having problems financially, this is an option for